Welcome to the Man Cave Podcast with Dan Casper.
Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine. It's got to be not a bad start to the new year for you, Austin. Your Vikings potentially playing for a top seed. Texas squeaking by with the victory against Arizona State. Got to be feeling pretty good for your football fandom right now.
I got to say, I'm pretty happy with how things are going.
Yeah, so we don't need to talk about that Green Bay game last week. That's still a little hurtful there, too. But nonetheless, did you have a good holiday, though, with the family?
Yeah, great. It was good to be with the family. Kids, I'm sure, enjoyed the time off, but back to the grind now.
Exactly. Well, I want to first start off about a player that we've talked a lot about, and now we've kind of got some answers. Jaire Alexander. Matt LaFleur indicated that he was probably done for the rest of the season, and then Adam Schefter said that Jaire actually had arthroscopic knee surgery on Tuesday to help out with the pain and the swelling in his knee. But Schefter said he possibly could play in the Super Bowl if the Packers were to get there. There was also some notes, too, that he re-aggravated the injury in that game against Chicago where he only played 10 snaps in that thing. When you hear swelling, because I talking about David Bakhtiari's knee and hearing swelling, I might be scarred quite a bit with that. Is it a little bit different with Jaire and a PCL, though?
It could be. The question really becomes is what did they do when they were in there arthroscopically? So when they talk about arthroscopic surgery, that's just saying the surgeon made two small poke holes, inserted a camera and an instrument, and did something. The real question is, what was that something? Well, based on the timeline, there's a 0% chance it was a PCL reconstruction. So we know it wasn't a full reconstruction of the knee. So then you start asking yourself, okay, what's going to drive pain and swelling in the knee like this after an injury? Well, right off the bat, usually with a ligament injury, there'll be some element of bone contusion or bone bruising that occurs. That's not something that you ever scope. So then it opens up the question of, like, is there also meniscal pathology or, heaven forbid, Bakhtiari, is cartilage pathology? So, I mean, is it possible when he injured his knee that there was a little cartilage injury and now he has a small cartilage flap that had to be debrided? Possible. I would say it's more likely, though, this was meniscal in nature. So it is not uncommon with a ligament injury to also sustain a meniscus tear. And they may have been just kind of watching those two things and saying, look, let's hope that this just calms down. Every time he tries to run, it doesn't. Proof's in the pudding. There, you got to do something. So if I had to bet, I bet it would be a meniscus surgery. But they didn't mention what it was. I was looking yesterday to see if I could find any kind of tidbits of information. And they just keep saying, quote, arthroscopic knee surgery to relieve pain and swelling in the knee. So my guess is meniscus. If that's the case, this should bounce back well. And like we've talked about before, PCLs often are non-operative injuries. Not always, but often they are. So in the long term, the hope would be that this calms down, doesn't need any kind of reconstruction in the off season, because that would certainly spell, at least 9 to 12 months of recovery. So obviously everyone's hoping that doesn't go down that route, but certainly time will tell.
And that actually is, yesterday when we were back on, we had quite a few people asking me to ask Dr. Crowe if there's any long-term effects, because there's a lot of talk about Jaire. Is he done in Green Bay because of the contract and the fact that he's missed some games here? And I think the big question is going to be, well, is he going to be healthy enough to go? So is it kind of just a wait-and-see approach now to see if that surgery helps with that and they don't have to do any more at this point?
Yeah, I think the answer is yes. I mean, there is always a wait-and-see element. Again, without knowing the exact extent of the PCL tearing, I mean, the fact that he tried to go on it relatively soon tell me it wasn't a grade 3 PCL, so it's probably a grade 2. So it means there's some fibers intact. I strongly suspect you give him the offseason and he's going to bounce back. I expect him to get back to pretty much where he was prior to the injury, truthfully. Could he lose a step? For sure. It can happen, any injury. And again, we're talking about what we know, which is the PCL, but there's clearly something else going on along with it. If it is a small meniscus tear that they just debrided, that shouldn't have any long-term effects. Mm-hmm. On the flip side, if it is a cartilage-based injury, that certainly is Pandora's box. I mean, as orthopedic surgeons, that's the one injury when you see, whether it's a meniscus injury or a ligament injury, when you see the associated cartilage stuff, that's where we start saying, all right, this is going to be a less predictable outcome. So you certainly hope that's not what the case is. But if it was cartilage, it doesn't fit a great timeline either. So, I mean, if they did like a microfracture procedure or any kind of cartilage grafting, there's no way he'd be back in time for a Super Bowl game. So I still lean towards meniscus, which is probably best case scenario for him.
Is it still kind of weird, because I still have the image of him when he came, he was just running in the end zone, and then all of a sudden he's limping off the field like he wasn't hit or anything like that. So is that still kind of a weird way to injure your PCL the way it kind of happened?
Yeah, it is. I mean, again, I think we talked about it, but the most common mechanism is a direct blow to the knee, especially when it's flexed, so it drives the tibia backwards. And that's how you assess the stability of the PCL. You push the tibia backwards, if the PCL is intact, it holds it. Well, a direct blow can pop that. It can be in combination with twisting injuries, but that's usually going to be a multi-ligament knee injury. So my suspicion is that may have been like a kind of a acute and chronic thing. So maybe there was a second injury. Hard to say for sure, but yeah, absolutely. I mean, you saw him just kind of come up limping, and it didn't. Like that probably isn't too much. It didn't look that bad. But clearly it's been a bigger issue than we thought.
This happened a couple weeks ago, back a little bit before Christmas, December 21st. Tank Dell, wide receiver for the Houston Texans, was it looked like a gruesome injury. Ended up tearing his ACL, dislocated his kneecap, and you were talking a little bit about it, damaged his meniscus. Correct if I'm wrong, but you've got a friend or a colleague that's on the training staff for Houston too, correct?
Yeah, he's the head strength and conditioning coach. So I chatted with him, and obviously he can't disclose a ton, but
right.
The reason for the admission to the hospital, he told me is because they were worried about an artery injury. So anytime you have a severe knee injury like that, so a multi-ligament knee, so his was ACL, MCL, meniscus, and a patellar dislocation. So that's a pretty severe knee injury. With that essentially, for a brief moment, the knee likely dislocated. And anytime you have a dislocation of the knee, now not just a kneecap, so the kneecap dislocations, now those aren't fun, but those really don't have those kind of serious sequelae usually. So in the setting where actually the knee dislocates, there is a relatively high incidence of injury to either arteries or nerves. And so the thing about arteries to the leg, you really only have one main artery going down the back of the leg. So if you lose that, you can lose the leg. So whenever there's concern for that, so I don't, and I didn't really kind of quiz them too hard on it, but I don't know if because they'll get an MRI. Sometimes on the MRI, you'll actually see what's called an intimal flap. So it's actually the inner lining of the artery, like a little piece kicks up. Those can clot off and create like a late vascular injury. So it like seems like the leg is okay, and all of a sudden, boom, you lose blood flow to the leg. Or maybe there's just the fact that it was a knee dislocation, they wanted to keep it for observation. But that was why he got admitted, because when everyone saw that, it was like, you could see in one of the pictures it was a kneecap dislocation. So you saw the patella on the side of the knee. So I saw a picture, I'm like, all right, well, at least it's a kneecap dislocation. Then they said he got admitted. Like, that doesn't add up. I mean, kneecap dislocations do not get admitted overnight. So you knew that there was something else going on. Good news is there was no arterial injury. So he's, going to have the reconstruction, and I think he may have already had it. And hopefully he can bounce back. Well, I mean, those are very severe knee injuries. And so the expectation is he gets back, but those are ones where there's always that chance they're just not quite the player they were before. But we've come a long way in being able to reconstruct knees. So certainly the hope is he gets back at a high level. But yeah, those are tough ones.
When you talk about the artery in that knee, would that have been similar to like Teddy Bridgewater's injury with that concern?
Yep, exactly correct. Yep. So Teddy Bridgewater. In fact, I just saw an article. Because it was really kind of hush about his injury. He actually kind of disclosed more. He had basically two injuries to the knee, and that second one was I think it was just in a practice, rolling out, and he just planted his leg, and boom. So you likely had one ligament that was already injured, or at least partially, and then there it went. But yeah, anytime we have a knee dislocation, you always worry about an arterial injury. And unfortunately, I mean, it happens across the country every year. There's either missed dislocations, or they diagnose a dislocation, but they don't really pay attention to the arterial injury, and people lose their legs because you just don't have a lot of time. I mean, sometimes by the time you notice that the artery is injured, you just don't have a chance to save the leg. So that's about as devastating as it can get. So, knee dislocations, as surgeons, are right away, our antennas are up, like, all right, is there any associated neurovascular injury? And so that's certainly what was going on with Tank Dell, and again, luckily he was able to avoid that.
Yeah, because if I remember right too, I think what caught everybody off guard with the Bridgewater, like they called an ambulance on the practice field, and because it was like kind of a non-contact type of injury too, I believe, right?
It was, yeah. He just stepped. He was rolling out, and I think he just planted his leg, and all of a sudden he said I was on the ground, and he said my leg was pointing in a different direction. So he had a full knee dislocation, and that. I mean, I'm guessing the trainers probably tried to do a gentle reduction, and then at that point they may have said, "Look, let's just get him to a hospital." Then that way they can sedate him and reduce the knee, because as you might imagine, popping a knee back into place
Yeah.
tickles a little bit on the way back in. So
yeah, I just shivered thinking about that. So, because every time now I think of knee dislocation, I think of Patrick Mahomes a couple of years ago. I don't know if that's the same, the kneecap, right? That was the kneecap?
That was just the kneecap, yeah. And so patellar dislocations, again, although they're not fun, that's just, so a lot of times people come into our clinic saying, I dislocated my knee, and you find out it's the kneecap. And that's, again, it's a significant injury, but it's very different. When you actually have the femur and the tibia come apart, that is a tremendous injury to the knee. And it's, frankly, generally a life-changing injury. So those are no good. And they tend to be very violent. So, if you think of some of the classic ones through the years, who was that South Carolina running back? I'm trying to blank on his name. But they had a couple of videos of it, and it just, that was all over social media for a while, just because his leg you just saw it flop. And those are, that's a direct blow with a defender. Not intentionally, but hit right on the knee, and it just crumples. And they're tough to watch. And again, it's just a really devastating injury to the leg. And again, sometimes you get those injuries to the arteries and nerves. That just makes it so much more complex, because then you're really, at that point, it's a limb-threatening injury where you're saying, okay, we're trying to save this person's leg.
Do you know, I don't know, this history lesson here, was that similar to, I remember Willis McGahee with that nasty knee injury he had with Miami. Do you remember that back?
Yeah, I do. Oh, for sure. I remember that in the national championship.
Yeah.
Yeah, he took that hit. I think they're playing Ohio State.
Ohio State, yeah.
I definitely remember that game. That probably was a multi-ligament knee injury. I don't know if his kneecap probably didn't fully dislocate. That being said, his was a really severe hyperextension injury. Those are a little bit higher incidence of injury to the artery, because as you can imagine, the artery runs along the back. It gets stretched. That puts tension. That's higher risk for either laceration or, again, that intimal flap I mentioned, which is, it's kind of subtle injury. And that's actually what gets people in trouble, because the first evaluation, sometimes it's negative. And they're like, look, we do something called ABIs. You basically check the blood flow at the arm and the leg, and they need to match. And if they're different, then you start worrying that there's something going on. But sometimes that's basically a false negative, saying, oh, yeah, it looks okay, but there's an intimal flap. And then 6 hours, 12 hours, whatever, a day later, boom, it clots, and all of a sudden you've lost blood flow to the leg. So it can be scary stuff for sure.
We mentioned it a couple times, and maybe just kind of a refresher, the knee bruise. And I know we talked about that with Giannis, I think it was a couple years ago during the playoffs and in the finals. And Christian Watson sounds like that's what he's dealing with his knee injury, and has missed the last game, possibly even this game coming up here with the Bears. Knee bruise almost sounds like it doesn't sound that serious, but it is a little bit more serious, right, Doctor?
Yeah, absolutely. So, the analogy, and it's just funny, I just had 3 patients yesterday with MRIs come back with all bone bruises. So I had this conversation a bunch with patients yesterday just about bony bruise, bony contusion. We use those terms interchangeably. But, just like a cut, when you say I have a cut, and that could be a paper cut, it could be like someone attacked you with a samurai sword, right? Those are both cuts, right? So, same concept. A bone bruise could be pretty minor. There are people who have a bone bruise that literally play through it. And you can have bone bruises that you're literally one step short of actually breaking the bone. And those people can limp for, 4 to 6 weeks, 3 months even. I've seen bone bruises where it's 2 and 3 months to fully recover. So, bone bruises can be really severe. So it depends on the location. It depends on the severity. So, when you look in the MRI, because they'll show up on the MRI, the bone lights up on the T2 sequences. That's kind of where we tend to look at them. And sometimes it's this faint little white spot, and other times half the tibia or femur lights up. So it just depends on the severity, but absolutely they can be really very significant injuries where people are it doesn't matter how tough you are, you're literally limping and can't walk on it, right?
Mm-hmm.
Or if you can, when you try to run on it, it's just your legs I'm not doing that. It just can't. So again, the bone bruise certainly is a term that downplays the severity. A bruise, how does he not play through a bruise? What? Toughen up, get out there. No, they can be really significant and really limit the ability. And often, not always, often they do go along with some mild ligament injuries, because often there's an impact on one of the sides of the knees. So as a knee, let's, for example, say gets hit in the outside, you'll get a low-grade MCL in the inner part, which kind of expands, but then it compresses on the outer part where the hit was. So you get a bone bruise laterally and a low-grade MCL medially. So there's often additional injuries along with it. So that being said, as soon as they're able to go, they can go. So, as the training staff, we'll often say, look, are you ready to play? And if they run and move and can can make the cuts and jumps, then we say you get back out there. And if they can't, then they can't. So those guys a lot of times will be those game time decisions where you work through the week, see if they can practice, see if they can play, and if they can, they can. If they can't, they can't. It's as simple as that.
On the last question here for you, because it relates to the next one I was going to ask you. So would you say a knee bruise is a little bit more serious than, let's say, and I'm not trying to downplay it all, but like Aaron Jones has a quad contusion, they're calling it. Would a knee bruise be a little bit more serious than a quad contusion?
Those are different. I mean, quad contusions can be the same. I mean, there's grading for those. Now, in lay people, we rarely get MRIs. The NFL players will, and you just basically measure, because generally they'll get a hematoma inside, so you get some bleeding inside the muscle. So you can get pretty severe ones. So those can be to the point where same thing. I mean, now, the far extreme of it, which is really rare, you can actually bleed enough to develop something called compartment syndrome where we have to do emergent surgery. That's really rare. But I had a teammate in college that had to have that done. But, a bad thigh contusion or quad contusion, that can be pretty debilitating too. So, I mean, I'd say those are pretty similar injuries because, again, they have very mild versions where people don't miss any time at all, and they have pretty severe ones that people miss weeks. So I'd say they're pretty analogous. I mean, different injuries clearly, but I'd say as far as there's a large spectrum. They can be mild, they can be severe. There's a lot of analogies between the two.
All right, before I let you go, I got to ask you, Sunday nights, you're going into Detroit. How you feeling about that game? Prediction time, man.
I mean, it's been a while since the Vikings have played a game of this magnitude. I mean, I guess they have playoff games, but this is just for one seed to bye. I mean, the loser drops all the way, down into playing on the road, so it's a huge game. Detroit is banged up a little bit. We're playing pretty healthy. We're playing well. I mean, I'm not going to go against us. It's going to be a tough game, though. I mean, Detroit certainly has a lot of weapons. I think it's going to be a close game, maybe something like 24-21, something along those lines. So I'll give my boys the nod, but it's going to be a tough game. I thought about trying to make a trip up there, but it's a night game, and I have surgery the next day, so my patients wouldn't appreciate me going up late if I couldn't show up the next day. But it should be a good one, and then I mean, the college playoffs have been fantastic as well. I mean, you look at that; it's kind of amazing. What is it, the 6, 7, 8 seed? Or
yep, every team that had a bye is out. So
that is crazy. I mean, although honestly, though, when you look at it on paper, you look at the seedings and you're like, I don't know if I agree with the seedings. So I mean, coming in, I expected a lot of upsets. I mean, wouldn't say I expected all four of these. Don't get me wrong, but the Ohio State game didn't shock me. The Texas game didn't shock me. Penn State game didn't shock me. I think Notre Dame a little bit. I thought. But obviously, Georgia lost their starting quarterback, so you have to take that into account. It's really, in my opinion, the national championship game is being played this week. With I think the winner of Ohio State Texas is going to win it all. But you got to play them all. But I think that should be a fantastic game. Ohio State's playing really well. But Texas' defense has been stellar, so that should be some really good football.
Yep, and I can't wait for that one next Friday, Ohio State, Texas. So I'll have to ask you your prediction for that one for sure, unless you're going to go down for that one. I don't know if you're going to
No,
go.
I don't think so. Although if Texas makes the national championship, I'm thinking about making it on because it's on a holiday. It's on Martin Luther King Day.
That's right.
So I already have the day after work, so I may try to pull that one off. We'll see. You got to win the game first. So
Exactly.
Take it for the hash.
Austin, we appreciate it as always, buddy. Enjoy the weekend. Best of luck. And, we'll talk some playoffs, college and football playoffs next week with you too, bud.
Absolutely.